Afyakit is an app that provides operational insights for managers of health, governments, financiers of health. It helps collect data and produce analytics that are useful for decision making, both for the managers of health, be they donors, be they other parties that are interested in this kind of information.
Health managers routinely carry out supervision of health facilities. It's part of their mandate. Generally, this is done using paper-based tools that are not very comprehensive, and that, at the end of the day, you have to, dig information out of, and then go and sit down and write a report, probably a Word document that is not necessarily analyzed and that cannot be aggregated. There was a need to improve this system, to optimize it, so that this activity that is routinely done actually yields information that can be better used by the decision makers at multiple levels.
With this app, I've been able to conduct the support supervision, get immediate data after the supervision, and even once you go back to that facility again, you can be able to get reference of what you found, all the gaps that you found, and how far they've been able to accomplish in terms of improving health services. All that data is analyzed in the dashboard, and this dashboard has been able to capture the 9 WHO signal BMOC functions. Now, these functions are very key in taking care of our mothers.
With the Afyakit, that comprehensive feedback is being given the same day of supervision. If the facility is doing poorly in an area, it will score red. When they are average, they'll score yellow. If they are doing well, they are within their mandate, it scores green. So this one gives the facility the opportunity for them to work on their gaps.
Through this kit, when the sub-county knows, they are able to identify the problems that the facility has. And they saw the need for us to have a TB clinic. They came, did assessment, and we have a TB clinic. So far, at least we have 2 patients who have completed the TB treatment. You see, if we didn't have the kit, maybe it could not have identified really if that is a great need for us.
This information enriches that process for deciding where to allocate resources. A lot of my experience when I was frontline was that sometimes everything was there except 1 or 2 components, and someone had not brought it to light. And so people just kept on suffering over and over and over again. And my report would barely ever get through to the point at which it can be acted upon. And we've seen this tool be able to transmit that information, because really it's the one report that is used right at the front line, and is the same report that is summarized at the strategic level. So all layers are looking at the same thing and working with the perspective that they need.
As soon as the county health management team of Nairobi saw what we had created for maternal and newborn health, they said, this is really interesting. Can you house our other supervision tools? And we've had other players now saying, we are working in the sexual-based violence area. Can you load these kinds of supervision tools on your app? Can you give us insights from the work that you're doing? And so Afyakit then developed into some sort of platform that houses all of these things, and that is growing every day.
We actually saw that this is an opportunity. This can be used beyond maternal and newborn health. It can be used beyond Nairobi. It can be used beyond Kenya. It can be used for other programs. Some of the biggest funded programs in this country, or even this part of the world, are HIV projects. Do donors always have last mile visibility of exactly where their money is going to? If I put money in, say again, maternal and newborn health, I see data on how many women have died or how many women have delivered, newborn, etc., etc., etc. But I cannot see, have job aids been provided? I cannot see in the farthest facility, are commodities available? Are they expiring? I cannot see exactly how that funding is being used. So this tool is actually giving an opportunity for last mile monitoring of health projects, health systems. When we started, we were initially targeting 6 facilities in Embakasi East, expanded to 3 more in Embakasi West. As of now, we are in 150 facilities. We're coming up with a project that will last the life of the project. But now we have a product that actually will last beyond the project. So for sure, we are blown by that. I appreciate the team because I think it has taken everybody's thinking to just, keep evolving it and improving it. And a lot of support from the donor. I think the donor has been, CICF has been extremely supportive. So we are happy to be where we are.